Good to go. All right. Good afternoon, everyone. Welcome to the Fresno County Department of Behavioral Health's Mental Health Services Act annual update, community, I would say community planning process virtual session. So hopefully if you're able to join us live right now, you'll be able to hear this information and interact with us through this virtual format. But we're also recording this so that individuals who are not able to participate in some of our in-person sessions can go back, view this, get all the information, and it is pretty consistent in all of our community planning sessions, and be able to submit questions, feedback, things like that. So it's a way for us to ensure that more people are going to be able to participate in that. I do apologize. I'm sitting here, so I kind of feel more like a news anchor. But we'll make it work a little bit. I like to be moving around. So first off, what we're doing is we're going to go through and provide just a background on what is the Mental Health Services Act and the community planning process. And then we'll go into providing some updates and some specific next steps for you guys. Do I need to advance to this? Perfect. Thank you, Brian. So real quickly, we're going to go into what is the Department of Behavioral Health, and you'll see on the screen over there. We are a county department. We provide and oversee the behavioral services in the county. We do have a specific population that we're focused on. So when it comes to the direct services or care, or what people think of like counseling or therapy, our focus is on individuals with Medi-Cal or uninsured, and who also have what we call a serious mental illness, so a diagnosis that is really severe. So most of the population of California is actually privately insured, so we serve a smaller population that are Medi-Cal eligible, and of those, it's a very specific population of individuals that have the highest need or who we target. However, with a lot of our other efforts, prevention, education, things like that, we do those broadly for all of our residents here in Fresno County. I'm going to go to the next slide, guys. So I'm now going to talk about what is the Mental Health Services Act. As of today, the Mental Health Services Act is the name for this effort. It was a ballot initiative approved by voters back in 2004. At the time, it was Prop 63, so you'll still hear references with regards to Mental Health Services Act. Sometimes people say Prop 63. We don't necessarily say Prop 63 because numbers are reused in years, and this was about 20 years ago. So there's other initiatives that will utilize that number. But the Mental Health Services Act, the proposition made it an act. And it was meant to do a couple of things. It was intended to provide funding to close the gap in behavioral health services, mental health services. It was meant to focus on an area that we had not done, which was, prevention and really trying to look at the whole person. And it also was intended to be transformative. And some of that transformation included opportunities to do things differently, to fund different types of services, like I said, to address the whole person, to do innovative efforts, to maybe address infrastructural needs that counties had been lacking for a number of years. So the money came with some specific intentions and goals. One of the other things that I want to put is that the Mental Health Services Act was developed based on that a 1% annual 1% tax on annual incomes over $1 million. So what that does mean basically is if I make $1 million this year, I would get taxed 1% of that tax would go straight for Mental Health Services Act. If next year I made $999,000, I would not be charged that 1% tax and it would not go into it. So the Mental Health Services Act is really funded based on how well people are doing financially and the economy. So in times that things are well, there's oftentimes more money. And at times where there's a slowing of the economy or things like recessions, it really does impact those revenues and the money that's available for care. So it's required Mental Health Services Act to really become more of a braided funding approach, not just utilizing that by itself, because in order to grow and sustain, you do need to look at other funding sources. Mental Health Services Act requires that the plan, which is what allows us to develop programs and to spend the money on programs, be developed with community input and address community needs. And so that's why we do this community planning process. In this case, this is for an annual update, and I'll go into a little bit more of that in a little bit. But we do community forums throughout the year, and when we're developing our new 3-year plans, we'll do a lot of community forums. So last year, around this time, we were doing a lot. I think we did, Aaron will correct me probably in the chat, but I think we did like 16 or 17 plus several virtual. a number of key informant interviews. We did a lot of other listening sessions, as well as, several hundred surveys, things of that sort. So we do try to gather input, and that's part of why we do these virtual sessions with the recording so that people can go back and catch the information on that. Our plan with this is that we will have this up and we will be taking questions and comments and things like that up until the holidays. And then at that point, we'll start developing the new plan, which we then will come back, present it to everyone, do the public comment, get more input, and move forward. So I'll get to more of that here in a second. Mental Health Services Act consists of 5 components, and you'll see those on the screen. Prevention and early intervention, that component has those multiple strategies, and so each one of those strategies has specific outcomes and requirements, and as a large county, we're required to have a program in each of those at this time. The second component is the community services and supports. That's our largest allocation of funding, with a heavy focus being on the full service partnership programs, which basically are intended to use a whatever it takes approach to address those individuals with the highest need. And then there's 2 other components, general systems and outreach and engagement. Innovation is the third component. So those are one-time funds. They're often either for 3 or 5-year plans, and we utilize those for pilot projects, demonstration projects, research projects. It uses the term innovation, but that's sometimes maybe misleading. So it's not necessarily focused on what's innovative, but what is something that you're doing that would contribute to statewide learning in the field. So it could be piloting a project. It could be doing a demonstration project. It could be doing a adaptation of something that was done elsewhere, which we'll get to in a couple of our updates in a minute. Workforce education and training, that was the 4th component. I say was, for the first 10 years of the Mental Health Services Act, counties received specific funding for each of those pots. After the 10 years, counties could still fund WET, workforce education and training, otherwise known as WET, with funds that they may want to move from their community supports and services through this process. So we've continued to do that. We've utilized those for things like scholarships, tuition reimbursement, loan repayment, things like that to help grow the workforce, and some of it for professional development for those direct services. And then the last one is capital, facilities, and technology, which goes to, I mentioned earlier, infrastructure. So a lot of counties had really old spaces, dilapidated spaces, spaces that were not accessible, not enough sites, old technologies, just a lot of things like that. And the one-time funds with the capital, facilities, and technology was meant to address that. And so we in Fresno County have utilized those for this current site that I'm speaking to you from our Health and Wellness Center. We've utilized that for updating things like our electronic health records to improve billing and tracking and service delivery. Capital Facilities Technology has been used for what is going to be the Olive Campus, which will have our adult and children's, mega campus. So there's different ways it can be utilized. After the 10 years, if you're going to put money into CFTN, you do have to move it from your community services and support. So if you have money that's not tied up to a program, that might be where people do that. And we are required to put those recommendations and plans into these annual updates or into the plans and make sure that we have those discussions with stakeholders. So everything in this does require us to have transparency and make sure that we are informing our stakeholders. So the next slide is, what is the mental health services plan? So I talked about it a little bit. Every 3 years, counties are required to create a Mental Health Service Act plan. That plan drives and guides your efforts in terms of how you will be using those Mental Health Service Act dollars. We just completed that last year, and so at the end of last fiscal year, we got our 3-year plan approved. So as of July 1, we're on the year 1 of our new 3-year plan. We are required to do an annual update. So anytime we're making anything that's a significant change, we're required to have annual update and public comment and public hearing, and we're also required to do annual reports. So basically, since we spent almost all of last year developing the new plan, our annual update right now is to try to recap everything that's been done, get some updates, and get that turned in before the end of this year for this year. You see on there, roadmap, it is done annually. That's the term, annual update. Annual updates for us are usually where we're providing some information and updates. I do want to clarify that for this particular process, an annual update, and usually we're not adding a new service or program. So what you're going to hear shortly is when we go through our annual update is not going to be here are new service or programs we're trying to do. And when we potentially get questions or feedback from you, you may go, well, why are they not, adding services? Annual updates are meant to really kind of provide if there's some changes we need to do, if there's some things we're needing to address, but it's not really an area where we do a lot of new development outside of innovation, and I'll touch on why we do those sometimes with innovation. Another reason why we're not doing a lot with this annual update in terms of taking on new ideas or trying to create new services or efforts is two-part. One, next year's revenues that the counties will be receiving will be actually the monies from the taxes that were collected during the pandemic. So if you remember, I said, that the money comes from that 1% tax. So if people were not making money, the COVID had caused business to close down, maybe someone who made $1 million that year did not make $1 million this year, those are going to impact our revenues. And so we already anticipate a drop in some of the revenues next year. And so we're wanting to be cognizant of that and not, try to expand when we may need to adjust how we do services. And then the other reason is something that is a factor is going to be SB 326. So SB 326 is going to be on the ballot as Proposition 1, and I'll go more into that in a minute. If that passes in 2 years or at the end of this 3-year cycle, how we do things and those 5 components, if you remember, I showed you, I mentioned, say will completely change. So we don't want to be developing things and then have to make shifts or eliminate those in 2 years. So for that reason, our annual update is really just providing this is what has been going on and really addressing one specific area, which is our innovation funds and some innovation plans. So I'm going to take a few minutes to focus on that area because that's the only area right now that we have had some kind of significant changes and also some opportunities for projects. So reminding everyone again, innovation are one-time funds. It's about 5% of our total MHSA allocation. They can be 3 to 5 year plans, and they're really intended to learn, demonstrate, or do some research. So on the screen, you'll see all of our existing innovation plans. This is updates on existing projects. So here's where I need to provide some updates. The Handle with Care Plus was a program that we developed and got approved right at the beginning of the pandemic. And it had been in works for about a year before that. And the pandemic and school closures and remote school and virtual school and all those things really made it difficult to implement. So we did wait, a year and a half, I believe, before we were able to get that project up and running. And in the end, after getting it up and running, there's multiple facets to it. So there's the notification, working with law enforcement, working with the chaplains, working with some of the partners, then notifying the school, and then the schools, monitoring the students and seeing if there's a need for any counseling or support for them as a result of something that may have occurred. Something life-changing is a term we've used, using the Handle with Care model, which is notifying schools when a child has experienced something, traumatic or life-changing, and so that the school can exactly what the term says, handle with care. So think with a package, a fragile package. Just make sure that this student has experienced something and just giving them some time to process, but also keeping an eye out on them. And then we had also, as part of that, as an innovative way, try to develop a curriculum, a parent cafe to kind of help provide trauma-informed resources and information. Well, I guess, let me rephrase that, to help parents become trauma-informed, to better understand how that incident may have impacted their child, themselves, or family, and being able to access the proper care. Over the past couple of years, for a variety of reasons, we just haven't been able to get as many referrals, get as many students into care, and really get the family participations in the parent cafe. And so in the end, working with our partners, we just looked at a lot of the resources that were being expended, but the number of people that were being served or accessing services was really low. And being that these are public dollars, taxpayer dollars, we do have a responsibility to be good stewards of that. And so if you kind of broke down the number of people we're serving with what the project was allocated, we were spending, a lot more per individual than what we actually had thought for and budgeted for. And so with less than a year left on this project, instead of continuing it as it was and really maybe not serving as many people with the money we're spending, we have looked at sunsetting that project, ending that project a little bit early, but we're going to continue to have the evaluation, and we're continuing. The notification system is now something in place, so the participating districts and county office are able to, do that part, and students can still be connected to services on the campuses, but it just won't be through this particular specific model and process. And the curriculum that was developed by our partners, our friends at Brainwise, is something that is available. So some of our partners are continuing to use that. The ones that were testing it, they will continue to use that. And we as a department are working on just some processes to make that curriculum resource available for any of our other community partners or organizations, so that we can continue to utilize that and have a trauma-informed community, and making sure that pilot, the efforts from that project don't end when that project ends, but we can take parts of that and continue using that in our system of care. So long way. The Handle with Care project, using the Handle with Care model, and the adaptation where we have the Parent Cafe, is something that we are sunsetting. We will have the evaluation still go, just so that we can, at this point, really find out and try to identify what were some of the challenges we had, in getting parent participation or people participation. We have another project, so I'm gonna go to the second bullet on the slide. I don't know, it's this way, whichever side of me it's on the screen. The Lodge. The Lodge is a program that we presented to the community several years ago, and it got up and running during the pandemic. It has targeted on working and engaging individuals who have a mental health or substance use issue, who are unhoused, homeless, or at risk of homelessness, and are in what we call in the stages of change, in that pre-contemplation stage. So they're not really engaged or open to care. Maybe the only time they get treatment is maybe they were in treatment or care a number of years ago, maybe when they end up in the hospital, or maybe if they happen to have a law enforcement encounter and they get sent to jail. That might be the only time they're participating, but the minute they're, out of a control setting and in the community, they just don't have a lot of options, and they just kind of go back to doing what they're doing. And so we were looking at, could we come up with a model that really utilizes peers heavily, and a really close to zero barrier as possible setting to bring individuals in, and see if that engagement, and really not forcing people, but just kind of give them their own time and hearing from peers and working with peers, people that maybe were in a similar situation as them, helps engage individuals. And so we've had some success with that. And again, these are individuals, like I said, that were not involved in care. And for we're considering success for this project real quickly is individuals that actually engage in substance use or mental health services that can get housed. So if they get connected back to family and they go that route, that's great. It wasn't something that we were looking for success. We had a very specific, as this was a research project, demonstration project, and we've had some good results with it. And it's really very similar model to bridge housing, which you may be hearing about soon. That's another way of supporting individuals that are unhoused. And so we last year proposed to our community that we would like to extend the lodge from a 3-year to a 5-year plan, and really be able to get more data, because we don't want to make a decision like if this is viable or not based on about a year and a half data at the time. Again, we started this during pandemic, so it did have some delays. We had half a year data 1 year, and the next year we had a full year data, and so this year's data was not going to be available for us in April, May of last year to make the decision, so we decided to extend it. So now we have that data that we're looking at, and very similarly, so we're going to have several years of data, and really looking at not only does this program work, is it viable, but what parts of it are working and really helpful, and so maybe we could utilize those models in other services and efforts as well. So the Lodge is a program that has been extended, so that was in our 3-year plan. There's no change there. Our justice-involved participatory action research, so that would be this way on the slide. The third bullet on there is a research project that we got great community input on, and going to be working in collaboration with hopefully some researchers as well as the probation department, and really looking at working with youth who are justice involved, and really having them get trained up and then provide input once they kind of understand the subject on what were the things that they needed, or what types of interventions did they need that they think would have been effective for them, and when, and things like that will inform potentially probation could inform schools, social services, behavioral health, with actual real information from youth locally in terms of what they needed and at what stage. And so that can really help drive and guide future strategies, plans, efforts, projects, programming, etc. That one was approved last April, I believe it was. We're in the process right now of trying to get that project up and running, which requires getting the researchers, getting all the partners, getting the evaluators, all the things for that. But that's a project that will be going on. It's going to be a 5-year project, and so we are excited about that. And we did build into some ramp up time, so we're not losing time right now. This first 6 months we're part of also the ramp up and planning, so we should be okay there. The Psychiatric Advanced Directives, otherwise known as PADS project, Fresno was the first one to participate in this, and we joined what was going to be a statewide project to do a multi-county statewide effort looking at really developing advanced psychiatric directives in terms of training people on how to use them, creating a standardized form or process, having a way to store them, access them, making sure that they're widely used, engaging peers in some areas to be the catalyst for those things. When we signed up for this project, it was 2019, long before the pandemic, and then the pandemic struck, and so the project did not move for about 2 full years. When it finally did move forward, there were, and Aaron will have to correct me, I think 5 or 6 other counties: Orange, Contra Costa, Shasta, Mariposa, Monterey. I might be missing one. So County of Fresno should be 6, possibly 7. Counties kind of started the whole process, and I don't know if you've ever worked in government, but we have ways that we do our contracts, and every county is a little different. So statewide, you're trying to get 7 different entities to kind of agree on how everything's going to look. It does take some time. So the project got up and running. It is about to finish up here in about a year. And a lot of the work has been done on trying to develop the tool, develop the storage, develop the electronic application or the pad itself so that it can be accessed by a hospital, by a first responder, by a person. What is that training going to look like? Who's going to be able to provide it? So a lot of focus groups, a lot of community input, a lot of specific work that has gone into that. And there is a proposal to do a statewide PADS phase 2, which would actually be the implementation. Now that everything was going to be created, having people actually develop it, do it, test it out, train, law enforcement, train hospitals, train first responders, train peers on how to do the PAD, and then making sure and following up and making sure that that PAD is being utilized, it's being honored, it's being accessed, things of that sort, and also just making sure from the person served and the family support system that they're able to access it and it works for them, and it's working out the kinks. So Fresno's part of the innovation plan as PADS phase 1 is coming to an end. We can't extend that one because we're reaching the full 5 years involved with the PADS. However, being that we were invested in this project for about $1 million over the past 5 years, we really don't want to not be a part of phase 2, which is like, okay, now let's implement it, let's use it, let's test it, let's see if it's working, let's get people a PAD, as well as some more legislative work that they want to do around it. So we are proposing today, and we'll be coming out with a more formal plan that Fresno is going to look at for a new innovation plan, participate in a PADS or Psychiatric Advanced Directives Part 2, which you see down there, this side, as the second big item, bullet point in there. So we will put together a kind of a proposal. We will put that information out to you guys. This is the first part of that process, getting some community input. There will be a statewide plan that will be developed, so Fresno will not have to write a whole plan, but there'll be a plan for phase 2, and then Fresno will write up basically like its scope of work or summary of like, okay, Fresno is going to join this project. What is Fresno looking to get out of it? How are we going to do it? What are the things that we're going to do? What is our investment in that project? But being that we were part of this for like the first 5 years and we're the first county on the ground to do it, we do not want to walk away at like the most crucial point, which is actually like trying to implement the PAD. So we were like, well, we were invested in it before. Let's continue the investment in there. Also, one thing that I think might be important for us to acknowledge, and I apologize not sharing this sooner, one of the things with innovation plans is those are funds that you have to use for innovation plans within a time period. If you do not use those allocated money, the money reverts back to the state. So basically, if you don't have money tied up to projects after a certain period of time, some of that money would go back to the state, and there's no guarantee you get it back. And so what we've tried to do in Fresno is be proactive. We don't want our funds to go back. We would rather use them for things that will really benefit our system of care and benefit our communities. And so that's part of our looking at a couple of new projects, is so that we can make sure that we're either extending those projects to expend those funds and really learn as much as possible, or look at new projects that will really inform and benefit our system of care, such as like a phase 2 with PADS. One of the other projects we have on here that I'm going to highlight is our CRDP evolution. So acronyms. CRDP stands for California Reducing Disparities Project. We're doing a California Reducing Disparities Project evolution. So California, through the CRDP, funded 35 community-defined evidence practice programs around the state. Fresno happens to have 3 of these. These were funded at the state level. We were really interested in seeing how these programs can add to our system of care, add to our spectrum, especially in those prevention, early intervention, stigma reduction efforts, and the community defined are specific programs targeting specific communities, not populations, but communities, and doing things that are not the way that mental health services are done, especially when we're looking at prevention. So in Fresno County, we have 3 of those CRDPs that work with communities. One works with our older Southeast Asian, primarily Hmong population, a very specific population. We have one program that works with our African American youth, utilizing concepts around agriculture and entrepreneurship as a way of addressing prevention, creating community connectiveness, having a non-stigmatizing way of talking about wellness and mental health and connectiveness. And then we have another one that focuses on working with Latino youth using some different and non-traditional approaches. When I say non-traditional, I should say non-Western classical approaches to mental health, which is you come into the room, you and a therapist have a conversation, or you are utilizing more of a clinical setting. So these are really doing things that are more culturally responsive and population responsive. So we have those projects developed, and our innovation part of it was, how do you take these projects that were truly developed at the community level and make them align with a specific funding source? In this case, it was the Prevention Early Intervention Funding Source of Mental Health Services Act. That, like I said, has to fit into one of those categories and has specific reporting and outcome requirements. If we go in and say we want to move this program to here, is it community defined if the county's coming in and making that change? Is it really community defined, saying, well, if you don't do this, I can't give you the money? That's not really community defined. So what we proposed to the state and the state approved was, like, we were going to work with those providers and really just provide them with technical assistance, and let them and their participants and communities see what is something that they could do to their program, an adaptation, or add something, or do something in a program that they still want to do that still works, but would allow them to match with one of these funding sources. So that's what we've been working on for the past couple of years, and also just ways that we can make those programs align with the funding that we proposed. One of the challenges we're now facing with our CRDPs, and specifically the community community-defined evidence-based practices, is we were trying to get these over during this plan to become a part of our PEI and part of our MHSA planning. Well, we're running into 2 factors. One is going to be the forecasting for the coming years, that our PEI funding will not be increasing, but will be a little bit lower, and so that makes it hard for us to fund these CRDPs with what we initially planned PEI right now. And then with what I touched on earlier, Proposition 1, which is focused on some of the changes, which I'll get to here in the next slide, around MHSA, would remove most prevention programs from being MHSA funded or county funded. So in order to look at how can we support and sustain these programs, we are needing to come up with a different game plan. So funding them through prevention might not be a sustainable option in the next couple of years. And so what we're proposing is to extend these CRDPs by, from 3 to 5 year plans also, but providing additional technical assistance for them to help them look at things that they could do that could maybe help them become an early intervention program, or programs that have not been utilizing Medi-Cal for some of the services where they can become or identify parts of their program services that could be billable and to offset those costs. And by offsetting those costs, help it become more sustainable. So we are going to be, we're proposing today, and we will provide a formal request and we'll post it for 30 days and all those things over the upcoming, probably this one we'll probably try to get done before January, because we do have to get it on calendar at the state and get it approved in time. But we are looking to extend the CRDPs to a full 5 year with the specific intent of adding the technical assistance to either do early intervention and or Medi-Cal billable services for the sake of helping it become a sustainable model and program. Because as of right now, I could be wrong, but I don't believe any of the 35 community-defined evidence practices in California that are funded with state MHSA dollars are doing specialty mental health services or doing Medi-Cal billable services. I think all of them fall into the prevention area, and so those are things that we need to really look at in order to make these projects sustainable and continued. So thank you to our CRDP partners who've been with us each step of the way and really open and receptive to efforts to sustain these programs. So now I'm going to go to the potential projects, and after that it's going to be downhill, guys, I promise. Downhill in a good way, like we'll be wrapping up, not like downhill it'll be going bad. Well, I don't know, that's subject to interpretation. Potential projects. So I mentioned the Psychiatric Advanced Directives 2. We're going to start working on that, but we are going to be limited in proposing something solid. So a lot of that is going to be depending on the timeline for the statewide project to be developed, and that'll have to get approved, and then we'll be added to it. But we will develop our portion and have those conversations with the community and stakeholders around that. And so that way, when we do bring the final state plan that'll have, I think most of the current counties, so I think most of the 6-7 counties are intending to participate, and I think there may be 1 or 2 new counties looking at it. So once that's developed for all of us, we would just piggyback on that, and we will bring that back to you guys also for your review and input. But right now, that's the direction we are looking at going, and in our annual update, we do want to kind of highlight we're extending a couple of these, we've sunsetted this, and these are new projects we want to add. And the other project that we're looking at is early psychosis. Having an early psychosis program. So we have the early onset or first onset team. In the past, we had some early psychosis programs, but not really to the level we needed to. And so we're looking at the future of both what is our system of care need, and we really do want to have a robust and effective early psychosis program. But we're also looking at what I talked about, Prop 1, which will require counties to have an evidence-based early psychosis program and doing those to fidelity. And so we are looking at a couple of statewide projects that are funded through the Mental Health Services Oversight and Accountability Act. Are those projects that maybe we will join? Or, because we are Fresno, we like to be innovative, or do we really work with maybe some researchers and our community and find what are the best models for early psychosis programs that would be viable in Fresno County? Remember, Fresno County, 10th largest county in the state, 5th largest city in the state. And I always tell people, if Fresno was in most other states in the country, we would have our own pro football and baseball team. So just remember that. But we're in one of the largest states with the most populations, and we're the 5th largest in that state. So we don't get, those big TV markets. But we need to have a early psychosis program that's really going to be able to be something that you can implement in Fresno, because we have so many variables. We have mountain communities that can be hard to get to. We have rural communities like Kalinga and Huron and Mendota on the west side that could take 45 minutes to get to. We have the 5th largest city, like I said. We have different demographics. We have different needs. We have some resources we have a lot of, some we don't have resources. So, we have programs that we could potentially leverage. We have things that we would need to build up. So we haven't figured out yet if we're going to try to join one of the existing state early psychosis pilot programs, or if we want to have you guys, and that's going to be part of this process. And for sure, you can email us at the end or weigh in and tell us what you think. But an idea we're floating out there is maybe Fresno says, hey, we're going to hire a researcher. We want to research all the best models that could work in a place like Fresno, and then work with you guys. I'm kind of do my Uncle Sam thing, like work with you to help us identify you, the stakeholder, you, the family member, you, the professional, you, the first responder. Hey, of these 4 or 5, and based what you've told us, we think this would be the best option for Fresno because we could do it. We could support it. It would work for us. We have the resources to do it. We would be able to sustain it, things like that. And so that may be our innovation plan, is not just identifying that over the next couple of years, 2-3 years, so that we do have something that we can implement potentially with the new requirements for Prop 1. But even if it wasn't for requirements of Prop 1, just having that, closing that gap in our system, having that early psychosis. And so that's something that we're, I guess, proposing here today for you guys to consider. Like, should we be looking at, joining a statewide project, or do we do kind of the Fresno thing, which is like, you know what? No, we want to see what is out there that works for a community like Fresno County. Because there's communities that have cities as big as Fresno and larger, but they don't have our rural communities. And then there's counties and communities throughout the country that have a lot of rural communities, but they also aren't balancing, I can't remember nationally what we're at, Brian. I think it's like the 30-something largest city. If there's 30-something, professional franchises in basketball, football, and baseball. If we were in the top 30-something, I think we'd have a team. We do have a team. We do have, our Grizzlies. We do have some of those teams, but I'm talking like, Major League Sports. So that's something that we really, at this point, are going to be hoping you guys provide some input, and that might be something that we work with Aaron, and maybe we'll put even a survey or a poll, Aaron, we could look at after we finish this annual update process in the coming weeks, that we could put on social media, and people can kind of like, hey, should Fresno explore one or the other? And maybe we can go from there and kind of utilize the community input in terms of which path we start looking at. We do need to put something together and get that done before the end of this fiscal year, which is June 30th. Same thing with the pads and the CRDP evolution, because if we don't get those done, then the money that is available, some of it could revert. And Fresno does have a lot of innovation programs. We have a lot of like one-time funds we're having to use specifically in this category at this time. And so we are trying to do things that are not one-time programs to where, well, what happens at the end of 3 years or 5 years and you don't have the money and you have to then, what's a program we really like, it works, we have to sunset it. We're really at this point shifting away from doing like direct projects and programs and really trying to do more of that research, more of that developing infrastructure and things that will be sustainable. So just something to think about as far as why Fresno might be doing some things the way they're doing. I'm going to go into the next slide, which is SB 326, now known as Proposition 1. So this is the part where I said, we'll be wrapping up so it can go, fairly quick. We'll provide you with the most information that we have available at this time. We do plan on having some additional presentations on this as we kind of understand a little bit more as far as what's going on, and as both leading up to the March election, as well as afterwards in April, to find out what happens. The county, we cannot lobby. We're not taking a position. We're not telling you what to do or how to, interpret these. We're going to give you what our understanding of this is at this point. And so that's what this is, this part of it. This does have significant impact on how we do efforts around Mental Health Services Act. So first off, this is an overhaul of how the Mental Health Services Act is set up. So the Mental Health Services Act we got in 2024 by around 2004. By about 2007, 2008, county started receiving the money. The community planning started. We started developing programs, things like that. We got regulations around prevention, early intervention, and innovation that were finalized around 2017, 18. So over that almost 20-year span, there hasn't been a lot of drastic changes other than kind of starting up in some guidelines. This one will change how the Mental Health Services Act operates. For one, it's going to change the name. It'll become the Behavioral Services Act. It will go from the 5 components that you guys may remember when I was talking about, CSS, PEI, WET, community, capital facilities and technology, and innovation. It'll go from the 5. It'll create basically 3 pods. One is for housing. One is for FSP. So FSP was a portion of CSS. Now it'll be its own. And one will be for what they're calling behavioral services and support. So they're broken down to about like 30%, and then 35% of the total funding. So prevention, the way we've been doing it, and a lot of those things under PEI, so prevention, stigma reduction, outreach, those things with the passage of Proposition 1 in a couple of years would be phased out. They will move to the state. The state is planning, if this passes, to take over statewide prevention. We don't know if that means that they're going to do it, if they will award prevention efforts locally through grants to CBOs. That part is waiting is still to be developed. But it does change prevention. It requires, out of that behavioral services support, that pot of 35%, half the money will have to go specifically to early intervention. Half of that early intervention will have to be for youth and children, the other for adult, and then everything else left would be done with that. I can't do the math on it. It's like 17 point something percent. So that means capital, facilities, and technology. That means everything that's currently CSS that's not FSP. So outpatient, continuums of care, core programs, everything under PEI that we're doing, things under systems development, innovation plans, workforce development would have to come out of that. And so that becomes really hard because you're taking resources that you had that provide you funding and then having to really, compact it to maybe a third of what you were doing before. So the challenge is to do more with less, and we're not sure how that would look like and where it would impact what programs, but it will impact programs and services across the board. And this is kind of why our emphasis is really to try to leverage as much of the FFP through Medi-Cal, federal financial participation, FFP through Medi-Cal to offset those costs. One of the other things that we also are looking at with potentially with Prop 1 and some of the changing in funding priorities is that we utilize that MHSA money for the Medi-Cal match, and so is that going to be reduced? Utilizing the Behavioral Services Act dollars are still going to be same structure as that Mental Health Services Act, which is based on that annual 1% tax on incomes over $1 million. That doesn't change. So if in a couple of years there's a recession or economic downturn, it's still the same funding mechanism. You're going to potentially have less money for some years, and how do you continue to reach and provide those services? So right now we're really waiting to see if there'll be in the upcoming session cleanup language, things that'll help define and explain a little bit more how things are going to work. What are things that we can move around? What are the flexibilities? Things of that sort. So it will have an impact across the board on everything, but we can't say at this point what it would be, what programs, what needs to be added, things of that sort. So we are trying to just be cognizant of the possibility of that and what we need to do, which is why we're not outside of innovation, which are monies we have to attach to programs and fund or risk losing. We are not proposing this annual update, if you saw on any of the slides, any new programs, any services, because there's a lot of unknowns. And so we don't want to have new commitments that we're not sure we would be able to keep. So right now our focus is what's going to happen with Prop 1, what impacts does it have, what does that mean in terms of with us, our community partners, and you all in terms of what we would need to do. And like I said, with the legislators are out right now. This has been signed for the governor's will be on the ballot as Prop 1. You'll hear a lot of things coming out for it. We don't take a position on it. We just ask you to inform yourself. And if you have, come when we do community forums, come to those, and we will do the best to provide updates as we get those. Prop 1, if passed in March, will take effect about 2 years and a couple months after that. So there is some time, but there won't be a lot of time for potentially a significant change to how our system of care has operated from the past 20 years to what it will be then. Don't say that to panic anyone. I'm just laying out the information to the way we understand it right now. Are there any things I want to touch on for that? There are some things with that with this community planning process that we do today, which is really we get your guys' input and is driven by your guys' input. and has given us a lot of latitude in terms of what we need, what you guys identify need, what we have money for, and try to address those, including coming up with some really innovative and creative ways to address needs. Prop 1 will make a lot more of this process and use of the funds kind of prescriptive. You have to put X amount to these programs. You must do these types of programs. You must do these types of programs. So in that regard, it will change how these things are developed and planned. However, it still does have the requirement for community stakeholder involvement like we're doing now. I want to see if I have any other slides. So discussions, I don't know if there's anyone on here, if there's people in the chat. If you're not watching this live, but you've gotten to this far, we're going to put the slides up in a minute with the contact info. Please email us your information, email us your comments, your thoughts, your questions. We will do the best to answer them. We're going to leave this open and take comments and feedback and questions probably right up to the Christmas holidays, the New Year, if you celebrate Christmas, around that time though, when schools will be out for the winter break. So it does give you ample time, over a month and a half, to provide any questions, comments, thoughts, things like that. We'll work on putting out some polls, like I said, specifically around potentially one innovation project. If you're not on our listserv, when you email us, we'll add you to the listserv, but also follow us on social media, because that's where we'll also announce, if there's community forums or other updates in terms of what's going on with Prop 1. This is our virtual session. We do have one in-person annual update session this afternoon from 5 to 7 o'clock at the West Fresno County Regional Office. It's right there by Edison High School. It's the same building that the library is in over there. Social Services has services there. That'll be today, and that'll be in person, and so you're welcome to join us for that if you're able to. But if not, and you're viewing this, you've got this far, you've got 6 weeks or so to submit questions, ideas, thoughts, feedback, anything like that we can do. I'm looking, it's on this one, it doesn't look like, Brian, there's anything in the chat. I don't know if Aaron's got anything in the chat yet. I'm going to forward this to the next slide, which has the information where you can get info. So if you go to, see this, I'm getting better, like I got the angle almost right. If you email MHSA at FresnoCountyCA.gov, you can ask questions, you can suggest ideas, you can provide input, you can get asked to be added to the list, whatever you want. That's the best way to communicate with us, specifically related to this annual update for the Mental Health Services Act. If you want to review plans, efforts, things like that, go to www.fresnomhsa.com or .org. Either one will work. Fresno MHSA, and that's where you can find also short clips. We have like 1 minute videos or less on what are the different aspects of MHSA if you want to go into detail and get a little bit more on those. You can review our plan. This last one we did reduce it from 600 pages, but it does have a lot, and then this annual update, when completed, will go on there. The proposed innovation plans and things that you'll be able to review and weigh in will also be on there. So, bookmark that page, FresnoMHSA.com, because that's where you'll find all of our information and efforts around MHSA. I know Erin messaged and said that she has nothing in the chats and has not received anything yet. I think we're going to give it about a minute, Brian. On the clock up there says it's 12:53, so we've wrapped this up in under an hour. Usually we do these community forums. They are about an hour and a half in person, but our presentation is a lot shorter because we're interacting with people, and we do provide a lot more time. With the majority of the time is actually for answering questions or discussions. This one being virtual and just providing some details. Want to provide you guys the details in case you don't get a chance to ask questions. So hopefully you'll be more informed, and it can help you in terms of participating in this process in the future. Again, we do have one today at the West Fresno office, 5 to 7. There'll be some food. There'll be the same presentation, just a little quicker. So you can check that out. And again, FresnoMHSA.com or .org, where you can get updates on any efforts around Mental Health Services Act, annual updates, and potentially if we get more information on the Behavioral Services Act as well. With that said, I want to thank you guys for, if you've lasted this long, thank you. If you're watching, thank you. Thank you for being part of the process. We really value you guys as our stakeholders. I always say, like, Fresno does try to engage as much of our community as we can. We started doing these virtual live streams before the pandemic because we thought it could be another way that people could participate, could maybe do it anonymously if they don't want to be in public, they don't want to be seen, they want to ask questions. So we're always trying to find ways to make this equitable and accessible for everyone. So thank you guys for getting to this point in the video. And we hope to see you guys at some of the future forums and meetings. Thanks.